Welcome to the Guthrie Clinic, Robert Packer Hospital Heart and Vascular Center. My name is Dr. Yang, and I would like to talk to you about a procedure called Transesophageal Echocardiogram, or TEE for short. TEE is an ultrasound of your heart. During a TEE, an ultrasound probe is inserted through your mouth into your food pipe. The ultrasound probe can show us the structures and functions of the heart muscle and valves from different angles. Many factors, such as body shape and size, make it difficult to get clear images during a traditional echocardiogram where the ultrasound probe is placed on the chest. The TEE allows your doctor to get better ultrasound images than a traditional echocardiogram because the probe is much closer to your heart. TEE can also allow your doctors to see some structure of the heart that otherwise would be difficult or impossible to see using the traditional echocardiogram. For example, left atrial appendage, where a blood clot is most likely to form. TEE is generally a very safe procedure, but as with all procedures, there are some risks that you should be aware of. Patients may experience sore throat after the procedure. People also may have reactions to medications used during the procedure, including, but not limited to, nausea and difficulty breathing. Very rarely, there can be injury to the throat and esophagus. You should let your doctors know before the test if you have difficulty or painful swallowing, history of gastric bypass, weight loss surgery, gastrointestinal bleeding, and also esophageal cancer or strictures. When you arrive to our facility, you will be checked in and be guided into a procedure room by our nurse. Your nurse will explain what will be done before, during, and after the test. Once in your room, your nurse will give you a hospital gown to change into. You will be given oxygen if necessary. Your doctor will come into the room to introduce himself to you and answer any questions that you may have before the procedure begins. Your nurse will also be doing the following to prepare you for the procedure: placing an intravenous or IV line in your arm and hand, connecting you to several monitors so we can closely follow your vital signs during the test. You will then have your throat sprayed with an anesthetic medication and give a mouth guard to protect your mouth and teeth. If you have sleep apnea, we may use a CPAP mask, which covers your nose during the test to help you breathe. Once ready, you will be given medications to help you fall asleep. We will then start the ultrasound procedure. An ultrasound probe will be passed through your food pipe and images of your heart will be acquired on the ultrasound machine. The procedure usually takes 15 to 20 minutes to perform. After the procedure, you will be monitored in our recovery room. Your doctor will let you and your family member know of the results of your ultrasound on the day of the test. A formal report of your ultrasound will be available within 24 to 48 hours on your test, and a copy of it be made available to the doctor who ordered this test. Since you will be given sedatives, you will be asked not to drive that day. Hence, we would need someone to drive you back home. A follow-up to see your heart doctor will be arranged. You will be discharged after a few hours on the same day. Since you will be given sedatives, you will be asked not to drive that day. Hence, we would need someone to drive you back home. I hope this video was helpful to understand what the procedure is and what you can expect on the day of the procedure. If you still have questions about the procedure, please do not hesitate to contact your doctor who ordered the test to discuss further.